Let's learn about tuberculosis. Tuberculosis, TB, is a bacterial infection that primarily affects the lungs but can also affect other parts of the body. TB is caused by Mycobacterium tuberculosis, a bacterium that is spread through the air when an infected person coughs or sneezes. Causes: TB is primarily spread through the air, when someone with active TB coughs or sneezes and releases bacteria into the air. The bacteria can be inhaled by others and cause infection. However, not everyone who is infected with TB will develop active TB disease. People with weakened immune systems, such as those with HIV, are more likely to develop active TB disease. Symptoms: symptoms of active TB disease can include cough that lasts 3 or more weeks, coughing up blood, chest pain, fatigue, weight loss, fever, and night sweats. In some cases, TB can spread beyond the lungs to other parts of the body, causing additional symptoms such as back pain, joint pain, and abdominal pain. Diagnosis: TB is typically diagnosed through a combination of medical history, physical examination, and diagnostic tests such as a TB skin test, blood test, or chest X-ray. In some cases, a sputum culture may be taken to confirm the diagnosis. Treatment: TB can be treated with a combination of antibiotics over a period of several months. The treatment is typically most effective when started early and followed closely to ensure that the bacteria are fully eliminated. Common medications used to treat TB include isoniazid, rifampin, and ethambutol. In some cases, a fourth medication may be added to the treatment regimen. It is important to note that TB treatment can be complex and can have side effects, so it is important for patients to work closely with their healthcare provider to ensure that they receive appropriate treatment and support. Prevention: preventive measures to reduce the spread of TB include screening for TB. Screening can help identify people who have TB but may not have symptoms. Isolation: people with active TB should be isolated to prevent the spread of bacteria to others. Treatment: prompt treatment of active TB can help prevent the spread of bacteria to others. Vaccination: the Bacillus calmette-guerin (BCG) vaccine can help prevent TB in children, but its effectiveness is variable and it is not widely used in the United States. In summary, TB is a bacterial infection that primarily affects the lungs and is spread through the air. TB can be treated with a combination of antibiotics over a period of several months, and preventive measures can help reduce the spread of TB. Let's learn about hypertension. Hypertension, also known as high blood pressure, is a medical condition characterized by abnormally high blood pressure in the arteries. Blood pressure is the force of blood pushing against the walls of the arteries as the heart pumps blood throughout the body. Causes: there are two main types of hypertension: primary hypertension and secondary hypertension. Primary hypertension is the most common type and is usually the result of a combination of genetic and environmental factors, such as age, obesity, physical inactivity, smoking, and stress. Secondary hypertension, on the other hand, is caused by an underlying medical condition, such as kidney disease, hormonal disorders, or sleep apnea. Symptoms: hypertension is often called a silent killer, because it usually has no symptoms until it becomes severe. Some people with hypertension may experience symptoms such as headaches, shortness of breath, dizziness, or chest pain, but these are not specific to hypertension and can be caused by other conditions as well. Diagnosis: hypertension is typically diagnosed through blood pressure measurement. A blood pressure reading is given as two numbers: the systolic pressure, top number, and the diastolic pressure, bottom number. Normal blood pressure is considered to be less than 120/80ths of a millimeter of mercury. Hypertension is diagnosed when blood pressure readings are consistently above 130/80ths of a millimeter of mercury. Treatment: hypertension can be treated with lifestyle changes, medications, or a combination of both. Lifestyle changes that can help lower blood pressure include losing weight if overweight or obese, increasing physical activity, Eating a healthy diet that is low in sodium, saturated fat, and processed foods. Limiting alcohol consumption. Managing stress through relaxation techniques or therapy. In addition to lifestyle changes, medications may be prescribed to help lower blood pressure. Common medications used to treat hypertension include diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. It is important for patients to work closely with their healthcare provider to determine the best treatment plan for their individual needs. Prevention. Preventive measures for hypertension include maintaining a healthy weight, exercising regularly, eating a healthy diet, limiting alcohol consumption, and managing stress. Regular blood pressure screenings are also important for early detection and treatment of hypertension. In summary, hypertension is a medical condition characterized by abnormally high blood pressure in the arteries. Hypertension can be caused by a combination of genetic and environmental factors, and can be treated with lifestyle changes, medications, or a combination of both. Preventive measures can help reduce the risk of developing hypertension,